I'm Julie Bartke with Session Update. The House and the Senate will move the major finance bills off of their respective floors this week, and the Health and Human Services bills are scheduled for debate on Monday and on Wednesday, and they do include cuts of $150 million to the base funding. Now, earlier, the GOP Rural Caucus addressed the media to point out an area in the HHS budget that is raising red flags with them, that of nursing home funding. Here's part of that news conference.
We've identified an area of critical underfunding in our state government. Even though the Democrats are prepared to take in about $3 billion in new revenue with both taxes and fees, they are offering grossly inadequate funding for the providers of nursing homes that provide care in nursing homes and in our care centers all across Minnesota. Administrators of these facilities have said they'd be better off if the Democrats' HHS bill didn't pass and that if current law stayed in effect. That's how bad this bill is.
115 facilities are now on the verge of closing, placing 15,000 employees and countless communities at risk. And this is simply just not acceptable.
And this is a manufactured crisis. This is one that we could have dealt with just a shift of values and priorities. As Representative Torkelson said, raising that amount of revenue and not putting the needed resources here is just not acceptable. This is our largest employer, or one of our largest out in our rural areas. And when we start talking about the loss of services by losing facilities, that's a very big deal for us. And more importantly, every time we lose a facility out in greater Minnesota, it's just that much further for folks to drive to get the care they need. So this becomes a very important issue in the rural areas.
What we've done in the Health and Human Services bill has been it's very, very difficult to stomach what it's going to do to the nursing home industry. You have about $113 million that is being spent on just the affordable care, the health insurance exchange compliance as far as technology. That could be going to the long-term care industry. I think that's a shame. You've got, as it's been said, almost $3 billion in tax increases, and we just automatically assume that long-term care is going to be shortchanged. Why is that? These are our vulnerable, these are our seniors, these are jobs, very good jobs out in Minnesota and greater Minnesota that we need to keep these people employed, some of the largest employers in our communities.
The Democrats set their priorities by putting their budget together. Every area in the budget got an increase except Health and Human Services. It got a $150 million cut. To me, that's pretty clear as to what their priorities are and how wrong they are. We can't change that. They have to change that, and that's what we're asking them to do.
Again, that was a portion of the GOP Rural Caucus news conference, and you can view many of our news conferences as well as the action on the Senate floor and in committee by following us on our Senate Media Services Twitter, Facebook, and YouTube accounts.